Health, an institution devoted to student health, wellness and psychological well-being. In the post-schooling education sector, recently launched 10 fully furnished mobile clinic units, and the units will enhance health services at TVET colleges, CET colleges, as well as universities around the country. To talk to us further about this now, we joined via Zoom by Dr Ramneek Ahluwalia. He is the Higher Education CEO. Doctor, very good afternoon to you. Thank you so much for joining us here on the SABC News channel.
Good afternoon, ma'am. Thank you very much, and good afternoon to everyone.
Now, you recently launched these fully furnished mobile clinic units. Talk to us about the services that these units will be offering to the students.
No, absolutely. I think specifically our rural South Africa institutions, which are in TVET colleges, Bizana, Ladysmith, you name a place, our semi-urban campuses, our campuses in townships, and I think that's where our key focus priorities are. And pandemics that are very embedded into young population of South Africa or to very disadvantaged South African population, naming HIV epidemic. We're also doing COVID-19 tracing tracking system to assist our campuses at this moment. Primarily also TB, STIs, providing contraception to young girls, non-communicable diseases, blood pressure, obesity, cholesterol, diabetes, cancer screenings. And so everything you can look at primary healthcare at easy access at the doorsteps of our young people so that our economy can be preserved and they can be looked after and they can focus into studies and so we can get competent graduates. And that's the whole vision behind this.
And I know that prior to this COVID-19 pandemic, there were, a lot of concerns really from staff members to students themselves, saying that it looks like these institutions of higher learning are not necessarily concerned of their well-being, psychological well-being and physical well-being. They are just, interested in them, pursuing careers. So the question really is, are there plans now to sort of increase these numbers to ensure that wide reach is attained?
Absolutely. We've got a very big sector. We've got universities which are quite big as a sector in itself. We've got TVET colleges. We've got community education training colleges. We've got work-based learning centers. So post-school education is quite major. So you're absolutely right. And something which I forgot also to mention is mental health and gender-based violence and services at the doorsteps are quite needed for them. You're absolutely right. So the aim is to start. So where we have campus clinics, we are establishing them as primary healthcare sites, which are predominantly in most of our universities. For TVET colleges, for CETs, for rural universities, we're working through our mobile service network, where these services will still reach routinely. But you must also remember that we also have put community healthcare workers almost at every campus in South Africa. And they are basically doing risk screenings for even mental health, even for gender-based violence like domestic violence, partner violence, sexual violence, perpetrator screening, and also screenings on HIV, TB, blood pressure, or unplanned pregnancies, etc. So these services that we are now talking about is secondary and tertiary healthcare that comes with specialized services, with specialized nurses, psychologists, social workers who come, take those referrals, and also give treatment on the campuses so that the students don't have to leave campuses. So this is above the network of primary healthcare that we've established in our campuses.
All right. So I think it was, in around June, a health check app was launched for students and staff across campuses. How has that initiative been received? Are you starting to see results perhaps from that particular app?
Very satisfactory. When we launched it in June, we actually did not know. Remember, daily screening for COVID is mandatory. It's by public regulation. It's very critical because if we can pick the disease early through the algorithm of symptoms, we can isolate cases very quickly and we can prevent the spread of the infection very quickly. And that's where you put tight systems and controls in a pandemic like COVID-19. Now, health check, you may remember our campuses have thousands of students, probably 10,000, 8,000 students coming at one time. at our campuses through the same gate. Congestion at gates can cause pandemic rise. And how do we find a systemic way where we can screen everyone on a daily basis and still have academic sessions running and our systems running? And I think health check, which was totally free on USSD, on WhatsApp, on web form, making very easy. You don't need a smartphone, and people can do their checks at home through the algorithm as prescribed by the National Institute of Communicable Disease, WHO, or Department of Health, helped us. So 5 million screenings have been done in the last 2 months. Over 1.6 million students are registered on Health Check now, who are doing their screenings on daily basis with staff members. So before they leave their res, before they leave their home, they actually know their status before they enter. And I think that has helped us at least curb the infection and put some systems and confidence to open our campuses and go through as contact learning.
Right.
So Health Check has been a great support to us.
So at this particular time, we're battling two pandemics. It's the COVID-19 itself, and you've touched a bit on gender-based violence. We know the impact of COVID-19, what it has had on mental health of many people. So what steps have you been taking to ensure that mental well-being of students is attained as they return in their numbers to campus?
You're absolutely right, ma'am. I think if the listeners are listening, one thing I just want to caution everyone is that this pandemic is not alone. It has got its tentacles to many other epidemics that embedded in South Africa and just been taken to another proportion. And I think that makes healthcare workers or country in general in a very difficult position of how to handle now multiple pandemics that are growing hiddenly. When the whole country focused on this major pandemic that the global world started encountering. Mental health, there is no doubt, is going to rise tremendously. Insecurities of life, insecurities of parents whose children are studying in institutions of higher learning or schools, and their loss of jobs. This is real South Africa. Retrenchments are real. Students don't know whether they are going to finish the academic year. How will they get learning in a way it should be? This year has been full of uncertain times. Similarly, domestic violence has grown. Sexual violence has grown tremendously. Data is clearly suggesting towards it. So Higher Health has launched a 24-hour crisis helpline. In fact, in last 1 month, we've had 500 crisis calls that were managed. And I'm very proud that even though there were 500 lives, because when the mental health crisis happens, or even a sexual violence happens, sometimes it happens at 2 in the morning. At 2 in the morning, a girl or a boy wants to commit a suicide. And at that time, we need to make them not find them being alone. If they have somebody they can talk to, they have at least someone they can call, a psychologist, a counselor, even managed by psychiatrists. If we can take that crisis and revert crisis, we can save lives. And then on the backup, we have now put a number of clinical psychologists that are now going to take the crisis and then manage them on a long-term basis, so that we also repair the wounds. We try to build a human in a way or a young life, so that they don't repeat that mistake ever again. So hoping that mental health, knowing that mental health and gender-based violence are on a total rise, the biggest desire is to build a crisis line, support crisis at a time. And then the other part is when it comes to gender-based violence and mental health, we also need to put systemic strengthening of infrastructure and controls at our campuses level. And I think parallelly, there's a lot of investment in work. The first one being the minister launching the whole policy on gender-based violence. And higher education becomes the first ever sector in Africa to have its own policy on gender-based violence in particular, and specifically on gender-based violence, which makes the vice chancellors, principals, management, student leadership accountable, and a social compact to come in place so that we can fight gender-based violence. Then, of course, infrastructure development, prevention tools, and gender-based violence. So we don't want GBVs to happen. But if it happens, then the crisis helpline starts coming in play.
As they say, it's a societal problem, therefore requires that societal approach. We have to leave it at that, but we thank you so much for coming through. All right, well, there you have it.